Hello, guys. Let's see how many people can we add. So, finally, I have someone to talk to. Yeah, keep post. Whoever is there, you can post your name or doubt, whatever you guys have. How is everyone doing? hope and pray that everyone is safe. And yeah, definitely in this pandemic, people are not having good experience. Everyone is going through some form of stress or personal loss. So I can see few participants have joined, but uh, guys, start posting, typing your name or start posting your questions so we can start this session. Krishna Vamsi, definitely I miss Jipma. I about Jipma, I miss the food, going to the beach, having an ice cream in the night. Those things I miss. Okay, so I have a question here. The question says, how much is vaccine efficient? Basically, for vaccine, we talk about safety, immunogenicity, then we talk about the efficacy, basically, in a way. So, in this vaccine efficacy, currently India is having two vaccine, like Covaxin and Covishield. This third one is Sputnik, which will be soon available. So all these vaccine currently this Covaxin and Covishield, they have efficacy of 81% as per the trial results. On and if Covishield is given around 8 to 12, so it has efficacy of around 81. And Covishield with Covaxin, whichever is the whatever the partial data we have, the efficacy says to be 81. And Sputnik, regarding Sputnik is a recombinant. It has a adenovirus vaccine similar like your Covishield. In Sputnik, the efficacy was to be seen around 91%, which is given after 21 days. The two shots are given after 21 days gap. So in the currently, like in India, like there are mutant strains and a lot of things are going on, and these vaccines are generally are said to be more effective in preventing the infection to be severe. Like if a vaccinated person gets a vaccine, if a vaccinated person gets a get this virus, coronavirus, so basically he's more likely to have mild or moderate illness compared to the people who do not get the vaccine. They are more prone to get the severe disease. I hope your question is answered, Aman. Okay. Aman, regarding the reference, okay, Aman, I'll answer your question that says ki reference about any study to be done in India. Definitely, this Covishield has done this bridging study. You can find in the internet. In regarding the Covaxin, AIMS Delhi has conducting the studies, and the result for the third trial one you can find through ICMR website. ICMR have also released the partial data analysis, and all this. Bef- High dreams do come true. I'm following you first. Thank you for following me. Hope something following my channel would have helped you. Uh, Krishna Vamsi, it seems like curve is falling in India. When can we expect the second wave to end? I won't say the curve is falling in India. Basically, every state is having a different curve right now. Like initially in Delhi, Maharashtra, it exploded. Now, after 3 weeks, test positive rate are reducing. So slowly, and but that test positive rate have is coming down, means like the transmission of the virus in the population is slowing down. That could be due to the lockdown also. That there it has several factors. Now, mostly it seems like it is a silver lining. It looks like cases are reducing, and mostly it reduces when all the population is either infected or vaccinated, so cases will come down. In Delhi it's going down almost. uh, this test positive rate has come down below 10 almost. And this when you look at simultaneously as Bangalore, Hyderabad, Tamil Nadu, there the cases are going up. So when you combine all these results, and most of the states, like if I give an example of Uttarakhand, where the reporting takes a lot of time and delay, and then to comment about man, that would be there in most of the states where the delay is there in testing. So uh, so to say that the cases are going down in India is won't be that definitive. And yeah, but it will take time, and we will come. It happens in all the pandemics and epidemics. After a certain rise, slowly case start decreasing. And how much time will it take? I cannot. I'm not. I mean, not even me. Most best of the best epidemiologists are finding it challenging to predict. Uh, Dreams do come true. Sir, can you give ideas regarding NEET if will postpone? Regarding NEET and how to study during this COVID time, most of the people are doing their COVID duties. I'll make a separate video soon, which I'll be releasing. Let's keep focus this on COVID vaccine and treatment. Aman Khan, sir, can we do study regarding titer of antibodies in Vidal in determining prognosis of COVID-19? Aman, I'm not able to get your question clearly. Can you elaborate? Vidal is test for typhoid, and if you're talking about titer of antibody, though, I think you're talking about for the COVID. So basically, whenever a person gets vaccine, Vidal is coming false positive on in COVID patient. You mean to say? Uh, my experience is Vidal will come positive with most of the. Even I've seen with the TB patients, they do come positive a lot. So uh, to comment upon whether it is definitely false positive, it's very difficult to say, or whether they are the carrier people who are having a Vidal positive. So, but we can't do Vidal on all these patient, all the COVID patients. And but if they are with COVID, co-infection can also exist. But a person can have a COVID with typhoid. That possibility also cannot be ignored. But yeah, if someone wants to do a research, they can definitely do it. And but typhoid is mostly transmitted with this fecal-oral route. So then results will be different in most of the, according to the geographical reason. Like if you are doing in an urban slum where there's water safety and hygiene is not good, there you may find more typhoid cases compared to if you're doing your study in a place we have a better higher water safety and hygiene, so they may find less typhoid cases. Yeah, definitely. Maybe by July, I was thinking to start about a course about research methodology methods. Whatever I know, I'll try to uh, provide whatever information I have. Because as a researchers, we keep on learning. It's a learning phase for everyone, and yeah, but at least at undergraduate level, I definitely feel everyone must have some idea. Like at my undergraduate level, I was able to do two research projects. Uh, One was within collaboration with Boston University, and one I did under ICMR as STS project. So that helped me actually in the undergraduate level to learn about research methodology and all. So, any question regarding COVID treatment, vaccine? So there is a question which says, "Sir, when should I get vaccine if I am COVID positive?" So it's a very burning, it's a sensational topic right now. Most of the people wants to know, and so we had a good discussion. Like I also keep on seeing on television lot of epidemiologists, professors, academician, this researchers. A lot of people talk about it. So there are guidelines, and there are hardcore research as evidence. So if a person get COVID, what the research have found is a person will have antibodies for right now around 6 to 8 months. People are saying, the researchers have found that most of the people will have antibodies, and their titer may dip around 6 month, but it will be adequate enough, and then again it reaches back to normal, and up to 6 or 8 months, the person will have a protective titer and antibodies, right? But the CDC guideline which says that you vaccinate them after 90 days. Indian guidelines, they say after 2 to 4 weeks they can get vaccinated. But now, like we are going through vaccine scarcity right now. To be uh, vaccine, people are not able to get vaccine. So at this moment, what my perception is based on the research, these people can delay it. They do not need vaccine right now. Even most of the my professors also agree with that. Few of them, most of them. So what they also agree is, if a person have a sufficient adequate titer, so we may not need to waste those vaccine dose uh, for them. Instead, it could be given to the more needy people right now. Okay. Any question regarding vaccine management, treatment? Any question? Okay. About pregnant ladies, should they get a vaccine or not? So this Regarding the pregnant ladies, currently, which now there is no evidence, no studies done in India on pregnant women. Now they have started for lactating women based on evidence. What they found was like if a lactating woman is given vaccine shots, then the antibodies are produced and it passes through milk, so it may be beneficial for the baby also, but it does not have any side effect to the neonate or the baby. About regarding the pregnant ladies, there is no evidence, but however, if a pregnant lady want to, she can get it by writing a consent and all. But slowly, I think this guidelines will update in time. With the pregnant ladies, in the first trimester, it could be avoided because that's a period of organogenesis. Late second trimester or third trimester would be okay. Generally, COVID in pregnant ladies is also seen like that. If a pregnant lady gets positive for COVID, uh, during second trimester, almost not much. The illness is all with the most majority of them also get mild illness only. In the third trimester, most of them may land up in ICU, getting a severe illness, uh, severe COVID. That is what uh, is the experience of doctor, and also in few limited studies. Okay, anyone? If you want, I can talk about a basics about vaccine if there is not so much doubt. Basically, one important doubt which I feel like is very important to discuss is in currently there is no live vaccine for COVID. So the type of vaccine which we have is as a viral vector vaccine, uh, like your Covishield, you have Sputnik, Johnson and Johnson. So these vaccine, what they do is like they will have another virus like adenovirus, and they modify them to produce protein similar like coronavirus. And most of them, these adenovirus or this viral vectors are not replicating. So they induce humoral and cellular immunity, and they are able our body whenever these vector uh, start producing a protein similar to your COVID. So what they do is our body makes antibody. Our body start making memory cells, but it does not cause any harm. And the similar way we get the immunity. And then there is a inactivated virus vaccine, which is a whole cell vaccine. In that there is it also produces humoral and cellular immunity, and for that we have a co-vaccine produced by ICMR and Bharat Biotech. Then we have this a Chinese vaccine, CoronaVac. So then there is RNA vaccines or DNA vaccines like your Pfizer and Moderna. What they do is instead of a virus, a nucleic acid is inserted, which results in the production of virus copies. And then there is another vaccine, protein-based subunit. In this, what happens? Protein subunits uh, extracted from the virus and the purified cell, and the virus-like particles are injected. These proteins mimic the structure of the real virus, and for that, like we have Novavax, AdaptVac. Okay, Yeah, guys, you can start posting your questions. So I guess we had a very small number of people attending this live session. I'm good, Dr. Pervez. I've recovered, but still mild cough I have. Post COVID, some symptom will take time to recover. How are you, by the way? Yeah, hope you are also safe, Pervez, and on COVID duty. So yeah, but I think we have very limited number of people attending this. So if there is no doubt, then we can end it. If you have any other doubt, please post it in the comment. You can see people are coming, joining, and then leaving. Or else the question, it could be thought of like that. Most of the people who is joining this are doctors. Any question regarding the vaccine treatment, or we can discuss. We all can try to. We can discuss some case scenarios if someone wants to. Dry tongue, redness of eye. Redness of eye are new symptom of corona. Dryness of tongue could be due to dehydration. Yeah, redness of eye was seen in few cases of COVID. So it was HEMA. But most of the patient like right now for COVID, they have symptom like is headache, fever, cough, sore throat. These are most of the and fatigue. Uh, these are the most commonly or then symptoms for COVID. Then, but the popular ones get like anosmia, loss of taste, and all those things. Re- Redness of eye is not so common symptom. Dr. Pravees once have asked me which vaccine is more safe, Covishield or Covaxin? Give your valuable remark. My point is right now, when you have a limited vaccines, people do not have option to choose. To be fair enough, and both the vaccine have in the trials in the research have shown uh, almost 81% of efficacy, and they are good enough. And right now, whichever vaccine people are getting, they should take it rather than waiting for it. Just imagine hypothetically, like if one vaccine is better than another, that may not have that much a vast difference. Almost all the vaccine will have uh, adequate efficacy whenever it is released in the market or it is being provided by the government. So if the vaccine, just for hypothetical situation, imagine this vaccine is able to give you a 1% benefit, then why not to take even that 1%? Why to lose that? Because a lot of people who did not take the vaccine initially, when there was a vaccine hesitancy, a lot of people were like, they're trying on me, I don't want to try it, you know. And now when the vaccine has become little scarce, evidence, like science keep on evo- evolving with the time, and as soon the more and more studies will be or the trial will keep on going, we'll be seeing in India itself more than 10 vaccine would be launched soon. Right now there are two, expanding to three, will slowly it will increase when there is because our population is too large to cover by two vaccine and all. So whichever vaccine you are, to answer Dr. Pravesh, so whichever vaccine you are getting, advice, my personal advice is get the vaccine, especially for people who are above 45, elderly people, people who have comorbidity, people who are at risk, like obese people, people old age, people with malignancy, people with diabetes, hypertension, cardiac, they must get the vaccine. Whichever vaccine you get right now, you take it. Then Rishikesh has asked me, sir, which is a wonder drug for COVID as per your point of view? It's a very interesting, good question, Rishikesh. Like as per whatever research I have done, uh, I keep on trying to learn from um by updating through research journals, watching other videos, and reading the news. So what I found, like initially, like people were running after remdesivir, people were going through, like it was like it started with HCQ, then Azithro, Doxy. Lot of drugs were came in market and gone, but ultimately, which is still right now, a lot of research, it came back to steroid. Steroid came to be life saving right now if the person have moderate or severe illness or the patient needs oxygen support. There the mortality has been significantly reduced with the steroid if it is given on time and with doctor's prescription. So the steroid is a wonderful drug right now, and it is a very old drug. People do not have to go to the the discoveries of new drug right now. This that Right now, like two steroids which are common in market and commonly given is your dexamethasone and methylprednisolone. So these both the drugs are wonderful drugs if given on time to a person who needs it, like a moderate or severe illness person. It is coming to be life saving. But generally, like what I'm seeing is people, like even in the private practice, or people are taking steroid by themselves and they do not know how to titrate the dose, how to, like even if a person needs a higher dose or the lower one. And because steroids is actually a double-edged sword, and it can do a significant harm to you if it is not taken properly. So Rishikesh, your second question is, why do you think testing rate has decreased in some state? With testing rate, I have uh, with testing rate, I do not have any much issues. And if some state have reduced it, so but I always like as a researcher, what you can always look for is the test positivity rate. Means how many tests they are conducting. Out of them, how many tests are coming positive. So if that number is high, then you can talk about whether the transmission is high or low. If you are looking from a statistical or epidemiological point of view, why testing is reduced, and generally it is seen when the testing is done less, then it can cause a increase in the test positive rate. So better to correlate all those things and try to look, and also it also depends, test positive also depends what type of test they are doing. RT-PCR is more sensitive than your rapid test, then try to look at that point of view. That will be a good one, good way to analyze it. And if some states have reduced, then we have to look at this, what is their test positivity rate, and uh, what is the like infrastructure, are they not able to able to do conduct the higher number of tests, or the people are not coming forward. There could be any other many multiple reasons for having a low test. Or then is, hi, good to see you, Saurabh. From Saurabh. You recovered, yeah. Thank you. And then, oh, Rishikesh is from Jipma. Thank you. Hi, Rishikesh. Nice to have a chit chat. Pravesh, thank you, doc. So, what all precaution and measures should take in case of pediatric COVID case for less than 12 years? Hmm, just a minute, Pravesh. So, I have given you my email ID to SK. He wants some for collaboration or medical consultation, and I definitely have my email ID, and have any email ID is there in my channel also. If you have any doubts regarding COVID, I'll try to help you out whatever I know, and even regarding your sex education or any area which I feel like I can help, I can contribute, then I'll do. So precaution regarding a pediatric case with less than 12 years. Definitely, there are scenarios where like mother or parents are negative, but the child is positive. And keeping your child, if the child is you're around 5 to 6 year of age, it's very difficult to keep him away from you. But what precautions we can do is, we can make sure that the there's we can reduce the his interaction of child with, yeah, with the grandmothers in the with the grandmother grandparents in the house, because those are at the higher risk. People who have comorbidity, their interaction can be reduced with the child, and we can have a limited caregiver, only a caregiver like mother would be the best one to have only have interaction, and the mother can wear mask. At best would be the double mask as advised right now. And before matlab, before feeding the child or after feeding the child, a mother should definitely do the hand wash. That hand hygiene is very very important. And mother could be part of the mother can one person should only have the maximum interaction with the child as a whole soul caregiver, and uh, they should take the care. Precaution is same, double masking, hand hygiene, maintaining the distance. Then is macroglossia to be caused by COVID. Till now, there is not much evidence regarding this. Okay, Saurabh Ranjan Sharma have asked a question. For a patient with diabetes age 55 who has recovered from COVID from pneumonia, CT score 15, a good substantial CT score, has current oxygen saturation level of 94 to 96 without any support. That's good. And after 25 days of infection, no, it's a very good, what I'll say, if the person is able to maintain saturation above 93, 94, it's a good one. It is a good recovery, which I'll say. And forget about the CT score now, what it had and all. Generally, people start treating the lab score. Those are not always, those are lab reports are needed generally for to take consultation or guidance from the doctors. And now people, they themselves are getting CT scan, which I definitely condemn it. And not all the patients require CT scan People feel start after getting a CT scan. They look at their score, they Google it, they get more scared, they start having more panic attack. Whatever damage is has done been done. Now looking at the same report, you cannot have the anxiety and all. That CT scan, or until unless that CT scan is advised by a doctor, and he need to, for your management purpose, he needs for guidance. For let keep the reports only for the doctors to consult, to guide himself. And there is no need to worry for this diabetic patient. But definitely, what I'll advise you is, if this diabetic patient is a 55 years of age, and look after his blood sugars, control or not control. Look after his BP also. If he has any cardiac problem or something, better what I'll advise you is, for these diabetic patient as he has a comorbidity, to continue low dose aspirin 75 mghs, at least for next 1 to 2 month, 1 to 3 month he can have it, uh, so that any post COVID thrombotic event could be prevented. With aspirin, better to also add clopidogrel as, or atorvastatin if his lipid profile, based on his lipid profile, to prevent any. Okay, sir, is GGO even in non-COVID patient? Rishikesh, can you elaborate what you want to know about your question? I do not know this short form of GGO. Can you elaborate that, Rishikesh? Hellfire. How do we confirm immunity after receiving both doses of vaccine, Covishield? Do we do we get anti? Okay, ground glass opacity. Okay, sorry, Pravesh. Uh, okay, I'll answer this hellfire question, then I'll come back to you, Rishikesh. So, how do you confirm the immunity after receiving the both the dose of Covishield or any vaccine? Yeah, definitely you have to get antibody titers, but it is not advised. Uh, it is not advised to keep on testing your antibody level, and antibody level will also only come when you take both the doses after 2 weeks. Then there is an antibody, substantial antibody is there, start rising. And it is not generally advised to get your antibody titers, and just get the 2 dose of your vaccine, keep on wearing, take all the precautions, be very careful till you get the 2 dose. And even post that, you should be very careful right now, because as the virus itself is mutating, there is a lot of variants coming up. What was the question? Ground glass you seen in non-COVID patient? Yeah, you can find there are a lot of causes for your ground glass opacity, the severe ARDS. You can find it out. It's very easy. Uh, so, what about the present strain B1.617? So, actually, if you know, that's a very interesting one. This all these viruses, these mutations are named after this Pangolian classification. You know, so how this is how it is named, like P.1. All these. So with the advantage of this classification is, now you don't have to name any country, regarding these viruses. Yeah. So, but there is a very, in India there is very limited data, which strain is it's causing very severe illness or not. But definitely, this strain, what we call as double mutant virus, B1.670. It is seen that it is highly infectious, like what is seen at almost more than 50% highly infectious compared to the COVID strain which we saw in the first curve, or the last year. This one is very highly infectious. Severity, we have limited data, but we're not seeing that severe cases. But yeah, if imagine, like, last year 100 people were getting infected, and out of that, if 10 people were getting severe, so it is 10%. So you get to see only 10 severe cases. Now, if the same virus is infecting 1,000 people, you are able to, if you are still getting 100 people, if then now, but your number have increased. So what in hospitals and most of the people see is, okay, pre last year it was only 10 severe cases, now we see 100. We never look at the proportional data. When we start looking at the how much was the proportion had the severe illness last year and how much is this year, then we can better comment about it. But generally not much is seen. But yeah, this year, but data is also limited, but less it is talked about, it is said that it is highly infectious. Severity level is still same. um, Dr. Rajat Sharma, sir, what is the role of community health physician in this pandemic? Yeah, I see myself as a community physician, plus researcher. I feel we have a very important role. When last year I worked only in at the primary care level, so I was trying to, definitely as a health education is a very important aspect also. Like, these days, if you see cardiac surgeons, different people from different specialties are talking about COVID. You know, like obviously, if it is a vaccine one, my virologist or a microbiologist would be better, would be able to better talk about it than me. But still we will be able to give a, there's something called like risk benefit ratios. We understand as a community physician, we understand the community, we understand what would be the common stigma, what is the structure of community, this is how it be, implemented. So when I was there in the primary care, so I came up with a lot of new ideas which we implemented at our PSCs. I made a blog about it. As a community health physician, educating people, providing care is also very important. At the same time, keeping a track of the evidence, okay, this trial is being done, this is effective, this is not effective, this could be done or not. Keeping of track of all those things and looking at the people's need and how can we come up with some innovative ideas could be a, community physician role right now. People have a lot of stigma. I keep on, whenever I get time, I keep on talking to community regarding the vaccine. They have a stigma, no, it will cause coronavirus, it kills people. People have a lot of different theories behind COVID vaccine, and then we can come up with certain ideas to how, how to address it in the community. Okay, community have this need, community do not want to go to tertiary hospital, they want to be taken care at home or something like. So if we can come up with something like that, that would be good. And right now in the second wave, whichever states are having second wave, right now, it's a fighting mode for them, so all the people from all the specialties have to come together and definitely have to work. And if we are in a fighting mode, then definitely you have to do the hospital duties, look after all the patients whichever you can, and then simultaneously you can do your preventive part or your health education part, or come up with some good ideas. So hellfire and and research is also quite important right now. Like in COVID, we have research from A to Z. If this much research we would have done on TB or any other illness, we would have succeeded. We would be have, eliminated this disease. In COVID, like in past 1 or 2 years, lot of research papers are there, and it's very difficult to find the quality and to assess. Whenever you have a research and data, then only it will guide you better. So hellfire, sorry. The question was, I only want to know, since I don't trust the cold chain process in my area, I am unsure if the vaccine retain their potency since refrigeration over here is very bad. I feel, Janil, look, why do you think that the cold chain would be is not good? Because the temperature which is required for these vaccine is 2 to 8, and most of the vaccines, like your polio, like in your area, definitely polio vaccine would have been given. A lot of other vaccine would have been given to children. So, and there is for those vaccines there is a vaccine vial monitors if you want to actually check. So with the vaccine vial monitor you can look if what is the, and like for your pentavalent vaccine you can do this shake test. So if those vaccines are safe, why do you think this vaccine will have the storage or the cold chain process? And right now better to trust them. And Rishikesh. So I asked the question because my neighbor has sent home, denying surgery, just seeing GG on CT, rather RT-PCR, uh, on rather RT-PCR not done. So I asked, okay, so do you think we can control and eliminate disease despite public and not following this? Okay, so I'll answer your first one, Rishikesh. Because this ground glass opacity, there is, and I'll talk about community medicine in that. There's something called positive predictive value. Right now, when the pandemic is going on, your test positive rate is high, and if RT-PCR generally look, the main indication of CT scan is when your RT-PCR is negative. So like your virus is not being cast in your RT-PCR or your before that if you did a rapid one and you have symptoms, then definitely go for CT scan. And CT scans, if the CT scan shows some opacity, some pneumonia or subclinical pneumonia, and then at that moment, if you say COVID, there is high probability that it will be COVID. So if there is a ground glass opacity, then yeah, surgery, better to deny the surgery. This would have been denied based also from the anesthesia side until unless if the person resolves or not. If I would be on your in your place, Rishikesh, I would have advised the patient to definitely take the RT-PCR and to monitor his health and start looking after for like categorize the patient into mild, moderate, severe, and start his treatment as soon as possible. Rishikesh, do you think then what your second question is? Do you think we can control and eliminate this disease despite public not following basic rule, wearing mask? It's very look. A work has to be done from the both the side. Some work would be done by the infection itself, the like if the whole population gets infected and the virus does not change, then where there were less likely that the second wave or the another wave will come simultaneously. If a whole population get infected, then if you look at the case fatality rate as of 1.5%, that itself, if you look at the population of 130 crore, then there will be a substantial number of deaths. To prevent that, you will try to save them through vaccines. Vaccine efficacy is also if you're seeing 60, 80, or even 90%, and not everyone is taking the vaccine. There is still a lot of vaccine hesitancy. So people have to reduce the transmission by wearing double masking, your safe distancing, sanitizer, hand wash. So these things have to be done at the same pace to reduce or control the illness. But despite that, like in the second wave, the main reason for the second wave, people say, most of the epidemiologists also believe, is one is that the people have people have taken their guards down, and there was a mass gathering and people. But the important point which people also believe, and which is also true, I also uh, firmly also believe, is this virus mutation. When there is a virus mutation, virus is becoming 50% more highly transmission and infectious, now said to be airborne. It's very difficult to you know be safe. So that's why government is, and everyone is also pushing to get vaccine, so at least severity will be reduced, we will be able to save most of the lives, and after a certain time this wave will come down, and so it's slowly. In the past also we have overcome a pandemic, or so I definitely like to be positive, to have this positive attitude, and still have, and hope that it will end soon. It may take time, but yeah, there will be one point when it will end soon. Advat, his question is, what about the situation of intern student, because they lost their final close posting and now interns too? This is, I've talked with a lot of interns and I am able to relate with them. One intern I was talking to, he was in Japan only. So, and it's a big loss, not only for interns, even for most of the residents. Like, like if you look at now all those surgeons, people who are orthopedicians, general surgeons, they have their surgeries are stopped. Their learning has also been hampered. Now they are doing only COVID duties, only COVID work. So their learning is also hampered. They get a less cutting chance, less practice, and but still definitely they will write the exam and get the degrees. And same ways, like even for this final years MBBS people, their postings have been, they have lost a lot of important stuff. It's just a But you cannot make them repeat it. So when I was talking to this intern in JIPMA, so he started doing he did a one more internship after that. He was like, sir, I'm still confused because my internship was not so well because there was no routine work was going on, and I was not able to connect with the department or the branches, and I was not able to decide which branch to take in PG. And it's a very sensible decision. So again he joined some missionary hospital in his area, in his hometown, so he can spend time with his family. And the same time, simultaneously, he's again doing his kind of an internship where he will be rotated in most of the departments, and he will get a basic idea right now. Because if you go to the small hospitals, they will also have a COVID work, but it will reduce after some time. As soon the wave goes down in that state or locality, cases will drop, and some routine work will again go back. So he wants to learn. So he wants to learn about all those things. So I was very impressed, and I always say ki it's better by the end of your internship you should be able to decide your branch, what branch you want. And that branch, because with that branch you have to keep on learn, you have to live for your next 60 years, or your name will always attach with that branch. So my personal advice is whatever is lost. You cannot now go back and do anything. But yeah, try to choose your branch very sensibly. If you have time, just go do your some rotational posting in some other hospitals. Try to learn, get an idea or about the branch, what work do, what is done. Because some subjects, some topics are good to read, difficult to practice. So, and some are easy to practice, difficult to read. Okay, could be like. So you just go, and whichever branch you feel much attached to, you should do that. Rajat Sharma, sir, how you see this pandemic from the perspective of community medicine patient? Does it hamper routine learning in community medicine? No, man. Like if I see, really from the bottom of my heart, I do not want this pandemic to be there. Okay, I've seen the worst of the worst in this pandemic, so I do not want anyone to even face this illness or this. But as a community physician, as a researcher, it was a good learning overall. It's kind of a practical live experience for us. Okay, this is what is done. This is how public health emergency is being announced. This is how a pandemic is being announced. This is how a response to be done. These all mitigations or measures have to be taken. But all new innovative ideas our government are taking to increase the awareness. So everything, all the topics will come in the pandemic. Looking at your the CFR, looking at your IFRs, looking at the numbers, test positive rate. There's a very good hands-on learning from it. But depends whether the person or community medicine people are ready to learn or not. Especially the vaccines. In the primary care level, we are only dealing with the vaccines. Like someone was also talking about the cold chain, how it is maintained, and how the vaccine efficacy is tested. To learn about trials, this pandemic was a good enough. And most of the trials, if you read from the community as a researchers, you can find out the loopholes, how a trial should, how to conduct a trial. So a lot of things are there to learn for us, in this pandemic. I have learned a quite good. So especially on infectious disease, pandemics, your statistics, yeah, infectious epidemiology is it's a very good learning. um Aisha Siddiqua, sir, far homeopathy could far homeopathy COVID prevention help kit in precautionary measure. As a researcher, definitely there is. I do not have the evidence right now, and there Ayush 64. I keep following, but all moderate. Nothing came, nothing much in for severe patient in Ayush. But regarding homeopathy, I do not have much idea. Uh, and if you can get some paper or something, do share with me. But till now, I have not seen much research on homeopathy. So, Advait, sir, how can we get an idea about the score? Advait, can you elaborate the question regarding the Corot score? I could not get Corot score, or like the areas how to score it. Which areas? Advait, like COVID areas or the COVID score, CT scan score? That one you are talking. Mm, hope Advait you are typing, waiting for your discussion. Like the areas how to score it. Which what was your Rajat has asked me a question. As an intern, how can I contribute in research about COVID during my rotations? And definitely talk with a lot of interns are doing right now. People are doing right and left research in COVID, and it's a very good opportunity to learn. But definitely, it should not compromise with the patient care. Okay, right? Matlab, uh, what I also feel is people who are doing research, they if they have acha, CT score, HRCT, that only, that I'll tell you about CT score, all the inflammatory marker scores also I'll tell you. So now Rajat came first again. So any idea for research topic? What you do is, uh, I'm like you can definitely contact your faculty, whether whoever faculty you have. Yeah, Advait, I'll talk about HRCT. So you talk with them, discuss. There are a lot of ideas people are doing quality of life. Matlab, depending on them, take a short one, and definitely you can look what are the presenting symptoms. Like people, what is the common topic for interns or people who are beginning their research? They are doing a smaller one, something like perception of patient in a hospital. That could be a little bit of qualitative. You can do add on like what are the symptoms patients are presenting with. You can look at the mortality data or mortality factors, like risk factors for higher mortalities. You can look for or people you can also writing a review paper, like systematic review, meta-analysis. That itself is a thing. But at the if you're doing your first research, do a basic one, something like prevalence, something like basic or if you can look at the if you want to do a clinical one. That's what I'm saying. Talk with the faculties. They are doing lot of all most of the hospital faculties. They are involved in some type of research. They will give you some part of their project or part of their research. They will involve you and take you in and try to learn how to analyze data, how to interpret it. Those are the most key important. Then later on you can do any research. People are even now making Google forms, sending it, looking for anything, like among the staff. You can look at how many got vaccinated, how many got reinfection post vaccination. These are the new topics which are going on. But I'll advise you, if everyone is doing the same study, kind of good, but it will waste of resource. So you can come up with something new, different idea, where there's limited study. You can generate evidence from your area. So that would be a good, that would be a good contributing toward the COVID. If you keep on doing the same monotonous study, may not much be helpful for researchers or people for like us. Uh, because based on all this research, later on some guidelines or something would be made. So better to come up with something new, interesting ideas. And so Advait, I'll come back to your question. Basically, CT scan scores. Now the common one, the people have done scoring out of 40, 30. So all these lung areas are divided. Now the common one which is goes is out of 25. It is said that if the HRCT score is less than 8, you can consider it to be mild. Based on these are just on the laboratory values. Then there is, if the value is 9 to 15, you can take it as moderate, and more 16 to 25, you can take it as severe. But the better one, like there is another scoring, CORAD score, where they score it 1, 2, 3, 4, 5, 6. Where if the CORAD score in the HRCT report, if you see, is 1, you can consider it normal. 2, you can consider as mild. 3, you can consider as moderate. 4, you can consider it as high. 5, you can say very high, and 6 is very high or critical. I know. So this CORAD scoring has been, came up with to be there. Then there is based on IL-6, which is the inflammatory marker something. So for the IL markers, you can say if it is less than 15, you can consider as mild. 15 to 100, moderate. 100 to 500, severe. If it is more than 500, you can say it as critical. Then there is categorization based on the, if you're looking at the CRP values, less than 25 mild, 26 to 100 as moderate, more than 100 as severe. D-dimer values, if it is less than 1, mild, more than 1, it is considered as moderate or severe. So IL-6 is there. Mostly we look at these values, CRP, IL-6 for inflammation if we have. Okay. Hope Rajat, your answer was, I was able to give answer of Rajat, Advait, and Chaya has asked a question. Sir, should a person in direct contact with COVID positive person take vaccine without testing for it? Uh, in direct contact. If I'm taking direct contact right now as without mask, if the person, Chaya, just I'll make it very short. The answer is, if you do not have the symptom, if you have never been tested, है ना? And if depending on, if when you made that, if the contact was made, direct contact was, imagine you made the last direct contact today. From the last contact, better to wait for the 7 to 5 days. Look out for symptoms, isolate yourself. If possible, get tested after 5 to 7 days if you are asymptomatic, so get tested. If test comes out to be negative, go ahead, take the vaccine. If you're not able to take the vaccine, wait for at least 2 weeks after the last contact, take the vaccine. But people are now it's a community transmission now, and you cannot be very sure of that you got the COVID only from that contact. There are asymptomatic carriers. You can get COVID from anywhere, and people are taking vaccine if they do not have any symptoms. But for you, I'll advise you better to isolate yourself 5 to 6 days. Look out for any symptom, get tested, and then take the vaccine. Um, Advait, sir, does chest physio helps in rising oxygen saturation? Chest physio is like if a person who is chronically ill, lying down for a long time, bedridden, is generally advised for them. If the person has a lot of cough, physiotherapy helps for them. As for oxygen saturation, it does not help you much. Like if a person who is having cough but not purulent cough, like your the cough, he's not able to, the expectoration is less, so for them just physiotherapy helps. And chest physiotherapy would be definitely helpful during your COVID or even post COVID, so it'd be helpful for them, but not much for your oxygen saturation level. So Rajat have another question. My PSM rotation is replaced with COVID ward rotation. Any suggestion regarding how to compensate this loss or experience in PSM department? Rajat, I'll advise you right now, clinical people need you. And what I'll say is your state, your patient, country, they are in a fighting mode. They need you right now. They are compared to your PSM rotation. And definitely you have to feel the importance, as a community physician, we always also look at the um, risk benefit, or what is the advantage, what is the opportunity cost. We always look for those things. And I feel it's important right now to work in a ward, if it is there in the ward. Do your ward work. If you are interested in PSM department or something, whenever this wave come down and all, talk to your faculty there, or even your post internship, if they are ready to, when the if the routine PSM community medicine work starts going, you can join it there. I don't, just for experience, you can go there, coordinate with your faculty. If, because if you have planned for community medicine in PG, I'll definitely advise you, start collaborating with them, start going to the department, meeting the residents. When, because definitely they would be also working on COVID. If you start looking after, okay, what all the works they are doing right now, but are they not, start contacting with them. I mean, if you have a good contacts with the department, they will definitely allow you. Even when your internship is over, you can go, look, see, experience. And even if, just for example, like if you're studying in some place and you go back to your home, there are a lot of NGOs which you can work with to get an experience of a community, how it is to be in the rural areas. Lot of trusts are working, get an experience from them. That would be, I think, wonderful. Like, whether like you can make a decision like Rajat, whether you want to continue with the community work, or you want to be a hardcore clinician and then later on come back to the community. You want to serve community as a community physician or as a specialization in something, and then later on provide service in that. There are a lot of ways to work in a community. So if you have research and all those, start collaborating with them. My advice would to you would be that. Chaya, hope your question is answered, even for Rajat. Abhishek Singh. My uncle CT scan report CT value is 5. Should he be taking dexamethasone? Dexamethasone is not, that's what the classification which all the hospital is doing is based on the respiratory rate and the oxygen. On 17th May, only new guideline came which stated that, the latest one from the ICMR, patient on moderate, if their oxygen saturation spo2 level is less than 93, respiratory rate is more than 24, breathlessness is there, you then only those patients can be given steroid under the guidance of physician when he feels. If this he's maintaining his oxygen, then there is no need to take dexamethasone. uh, but I'll advise you, Abhishek Singh, to provide me more details, like when he got his symptom, did he had um, oxygen drop, was dexamethasone was started to him just because but right now, like, he's on recovery phase, so dexamethasone has been tapered, so all those things would be required. So if you are just saying, if I'm looking at your question, if the person has CT value of 5, he does not have any oxygen problem, he is a mild case, then definitely for mild cases do not give any steroid. Advait sir, as per report, third wave will affect children, but their immune system is high when compared to the adult too old. What is the cause that will affect children more? Advait, but the theory, it's still a hypothesis and theory. People are saying that we are in India, we are vaccinating more than 18 years of age. So this less than 18 years one will become more susceptible because they're not unvaccinated and very less right now, like we have to look at the zero prevalence, like how many children are already affected. So this group is left unvaccinated, more immune, more prone for the infection. That's why they are suspecting that the infection will be in the children. But it cannot be, predicted, and nothing can you cannot predict this thing 100%. Raj, a lot of people have deleted their doubts. Raj Kamal, GJ, ओके, दिव्यांशु कुमार सर, मेरे पापा को वैक्सीन कोविशील्ड डोज 1 लेने के बाद फीवर आया 100 एंड हेडेक है। सर कोई मेडिसिन लूं या एक दिन रुक जाऊं यस्टरडे वैक्सीन के लिए? लूं या रुक जाऊं, यस्टरडे वैक्सीन लिए थे। अच्छा, हाँ, नो नो, बेटर टू गिव अ पैरासिटामोल, देयर इज नो हार्म इन गिविंग पैरासिटामोल, दिव्यांशु, give him paracetamol. That would be at least symptomatic thing. And I hope इनको ये जो फीवर है वैक्सीन से पहले नहीं था, है ना? तो वैक्सीन के बाद थोड़ा बहुत फीवर होना, हेडेक होना, लोकल साइड में पेन होना, सब नॉर्मल है. गिव हिम पैरासिटामॉल. सम सिम्प्टोमेटिक रिलीफ शुड बी देयर. नो वन शुड सफर फॉर फीवर एंड पेन. तो जीजे का क्वेश्चन है, HRCT score 10/25, CRP 15, high grade fever between this, SPOT is fluctuating between 92 to 95. So yes sir, पहले fever नहीं था. Okay, good enough. Devanshu, give him the paracetamol. No need to worry. क्वेश्चन कहाँ गया? जीजे का क्वेश्चन we were reading. SPOT is fluctuating between this. Gigi, if you can give me more detail of patient, I'll be able to better provide you. Like, उनकी एज क्या है, उनका जो है, अगर देखो, यार, अगर मतलब उनका एज क्या है, उनको कोई कोमॉर्बिडिटी तो नहीं है ना? Based on if we look the CT score or of 10, then it comes under moderate. If we look at the CRP, it comes under mild. तो एंड ऑक्सीजन सैचुरेशन अगर 93 से ज़्यादा मेंटेन है, उन्हें सांस लेने में कोई दिक्कत नहीं है, आई कंसिडर एज माइल्ड. डू नॉट गिव एनी स्टीरॉइड अगर 93 से ज़्यादा है. अगर कोई ब्रीदिंग कोई डिफिकल्ट नहीं है, तो नो नीड टू गिव. उनका डे ऑफ इलनेस क्या है उस पर भी डिपेंड करता है. Better to give him symptomatic treatment. Give him paracetamol. If he has cough, give him cetirizine or Montelukast or any cough syrup. If was he अब उनका RT-PCR या फिर अगर एंटीजन पॉजिटिव आया है, तो you can give him ivermectin, है ना? For ivermectin for 3 days, empty stomach early morning, and then just for whatever this symptomatic treatment for mild you can give. अगर ज़्यादा कफ है, बहुत ज़्यादा, अगर थोड़ा बहुत दिक्कत हो रहा है, तो बेस्ट इज़ ब्यूडेसोनाइट का एक इन्हेलर या पंप ले लो, जिसमें जो है, जैसे उनकी अगर कोई ज़्यादा डिफिकल्ट, फॉर इमरजेंसी ऑल्सो यू कैन यूज़ द ब्यूडेसोनाइट थिंग, दिस इन्हेलर. सो जब भी उनका अगर कभी ज़्यादा कम फ्लक्चुएट हो रहा है, बेटर है उसकी पेट के बल वो लेट जाएँ, प्रोन तकिया लगा के. प्रोन लाइंग यू गूगल, तो प्रोनिंग कैसे करते हैं एक बार देखना. पेट के बल तकिया लगा के आप लेट जाओ, उससे तो काफ़ी अच्छा आराम मिलता है पेशेंट को. एंड ही कैन, अगर ज़्यादा दिक्कत हो रही है, ही कैन टेक ब्यूडेसोनाइट का इन्हेलर. ठीक है? तो और जिंक, विटामिन सी, विटामिन डी, those things for mild, definitely he should start the treatment if he is positive, है ना? एंड कीप मॉनिटरिंग हिज ऑक्सीजन. दिव्यांशु सर, मेरे पापा हो गया. सौरभ, दिव्यांशु कुमार सर, मेरे पापा को वैक्सीन लगी थी, लेने के बाद फीवर तो हो गया आई थिंक ना. अभिषेक सर, Abhishek sir, his symptoms started 10 days back. He does not have any respiratory problem, oxygen 19, but he's taking dexamethasone. No, then मतलब why it was advised, अभिषेक? डेफिनेटली अगर उनको कभी डिप हुआ था उसके बाद था तो ठीक है. अगर डेक्सामेथासोन अभी वो ले रहे हैं, तो धीरे धीरे आई एडवाइज यू कि 10 दिन हो चुके हैं, पर उनको एडवाइस इसलिए किया गया था कि उनका सैचुरेशन लो था, तो धीरे धीरे करके टेपर ऑफ करके यू कैन स्टॉप द डेक्सामेथासोन. यू टेल मी कितना डोज ले रहे हैं, धीरे धीरे वी कैन टेपर इट ऑफ. और उनका स्टार्ट क्यों करा था वो भी बस एक बार बता दो. कभी ऑक्सीजन उनका 93 94 से नीचे नहीं गया था, कभी एडमिट नहीं हुए, तो फिर आई डोंट थिंक देयर इज नीड फॉर डेक्सामेथासोन राइट नाउ. मोस्ट ऑफ द people are getting steroid even for mild illness, which is not advised. Rajkamal, sir, I recovered from mild COVID. I'm 20 years old. I completely lost my taste, smell. I feel nausea when I see food. Okay. Rajkamal, ऐसा मेरे साथ भी होता था. Even I used to had this thing, but I lost my taste, and then I used to have, and generally I am not able to tolerate much of chilies. I used to have more chilies that time, just to have see ki okay, but does it makes me feel the burning sensation or something like that. But it will come back in time, Rajkumar. Do not worry about it. और आपको कितने दिन हुए हैं, how many days, what is the day of illness for Rajkamal? uh, Depending on that, it will come within few days. Do just keep the patience, and but definitely at least have this fluid diet. Do not, so your electrolyte nutrients are not deficient, you know. Keep taking multivitamin tablets, vitamin C. It will come back. If nausea is ज़्यादा है, तो you can definitely take ondansetron, and yeah, for gastritis you can take Brantac, no, but Brantac 150 mg BD you can take, and for nausea you can take ondansetron 4 mg TDS. मतलब एक दिन में 3 बार ondansetron और Rantac सुबह शाम ले सकते हो खाने के बाद. दिव्यांशु, यस सर, पहले फीवर नहीं था. पैरासिटामोल कितना mg वाला, एज 42. दिव्यांशु बेटर रहेगा. दिव्यांशु यू टेक, यू गिव हिम 500 mg का पैरासिटामोल, इजीली एक्सेस अवेलेबल. 500 mg का पैरासिटामोल उन्हें दे दो एंड नो इश्यूज. और एक दिन में 3 से 4 बार तक दे सकते हो, खाना खाने के बाद दे देना, कोई इश्यू नहीं अगर उन्हें ज्यादा वो रह रहा है. Rajkumar, it is 8th day. Rajkumar, then it is, if it is 8th day, it will take time to get your taste and all those sensation back. It generally takes around 10 to 20 days, you know, or I feel generally by 14, 15 days, it will come back for you. Just 8 days still, generally 10 days ka to isolation hi hai generally, no? So it will take time for you to come back. So any more question? Hope Rajkamal, your question have been answered. Divyansu, give him 500 mg paracetamol, and Abhishek Singh. Yeah, Abhishek Singh have to tell me why dexamethasone was started. If there is no dip, if there was no dip, take off slowly, taper the dose of dexamethasone and stop the dexamethasone. है ना? And मतलब देन ठीक है. एनी वैक्सीन लगाने के बाद कुछ थोड़ा बहुत होगा ही, इफ एनी. निजाम अली, हाय निजाम, एनी क्वेश्चन फॉर मी, आई कैन हेल्प और वी कैन डिस्कस हियर. And overall I had a good experience. There were only limited people, but yeah, I got to. Any more questions, guys? सर मेरे अपने पीएमटी को दिनों के बारे में कुछ बताइए. सर अपने पीएमटी के दिनों के देवेंद्र, वी विल कीप इट सेपरेट लाइव सेशन एज अ फ्रेंडली वन. इट विल मतलब है ना, तो that would be I think good. Otherwise, because I'm trying to keep it focused on COVID, but still I'm going right and left to tell. But बताएंगे, will have a different session for it. Saurabh Ranjan, when remdesivir is prescribed, generally right now remdesivir is highly talked about, and when in my school time they used to say bhokal barchana. So this remdesivir का काफी ज्यादा भौकाल टाइप मच गया था, and then people started doing this black marketing, and lot of stuff has happened with remdesivir. So remdesivir right now, if I talk the latest clinical guideline from your ICMR and AIIMS National Task Force. So what they say is remdesivir may be considered only in patients with moderate to severe disease who need oxygen support, and simultaneously उनको liver और उनका liver और kidney function tests should be normal. There should not be any dysfunction, and who are within 10 days of onset of symptom. Within 10 days जब से symptom चालू हुए 10 days के अंदर can be used. And remdesivir generally should not be used patient who are not on oxygen, or if they are in home setting, better not to use remdesivir for those. So, and now the most of the places, after the lot of evidence have come, people are finding remdesivir is not much effective, and they have stopped giving remdesivir, and lot of uncertainty is there around remdesivir. What is the treatment for mild COVID case? Medicine name. Okay, Devendra. I'll tell you the name for the mild COVID cases. But how do we deal with? Definitely, we give paracetamol 500 mg. It can come with the name of Calpol, Dolo. So you can give them 3 times a day if the person is having fever, or 4 times a day. And then cetirizine, if the patient have the sore throat, 5 mg BD you can give, or 10 mg in the morning, night, or and in the night you can give. If the person have running nose and all, definitely vitamin C, 500 mg, subah sham, morning and evening, at least for 10 to 15 days. Vitamin C you can take. That has to be chewed, you know. It can come with the name of Lim C, brand name, if you are looking. And then you can look for, you can give vitamin D3 with calcium. You can give, it can come with the brand name of CCM, Sipcal 500. Give it morning, evening, for 10 to 15 days. Or else you can have vitamin D3 k sachet, 60,000 IUK. Then you can give 50 mg zinc once a daily for 10 to 15 days. You can give every day. If the person have cough syrup, then he can take syrup for name with the name like Brilliantus, or the brand, other brand. It can come with any other, Alex. There are a lot of brands for cough syrup. And ivermectin have to be given. It has to be given with 200 micron per kg. So generally for an adult who is 60 kg, so we give 1200 mg. Uh, Vaccine. Uh, Sorry. Um, so ivermectin can be given for 12 mg every day, early morning, and 1 to 3 hours before the food for 3 days. Empty stomach have to be given. So these are generally the symptomatic management. And for mild cases, do not take steroids for mild cases. No need of any other antibiotics. And only if fever persists for longer time, then we can start. Or if you are starting having a steroid, then to cover that we can give. For mild cases, not to give any antibiotic, not much antibiotic and steroids. So, or no, nothing like Fabiflu or any antiviral drug, in the for the mild cases. Even for ivermectin, it is like, uncertainty regarding the mild cases. So hope Devendra, your question is answered. And Nizam Ali, actually I'm here because I'm a NEET aspirant and follow you. Jipma Pondicherry is my dream college. Nizam Ali, you will all my wishes and prayer for you. You will definitely get it. And why vaccine? Okay, then hope you are also learning something, Nizam Ali. Start looking for, like, how this vaccine for your, if you're interested in NEET, start looking how this vaccine work, humoral immunity, and um, cellular immunity. You can read. Then there's Eternal Cosmos. Why vaccine is not working? Sad demise on KK Agrawal. Vaccine has a limited efficacy. One thing you have to understand, and virus is also changing now. There is people are talking about triple mutant. Definitely, it's a sad demise of Dr. KK Agrawal. We, as a whole medical fraternity, will miss him. His all the patients will miss him. He was a leading landmark right now, and we feel sad for him. Yesterday only I got this news. He has lot of patience, and I think um, this is kind of like keeping a live chat like this with you guys is also, it's inspirational for me to learn from him. At the even at the when he was in oxygen support, still he was taking live seminars, helping people like this. It's very commendable job he did, and he was a wonderful human being, which I'll say. You know, I feel sad for him, but vaccine has certain limitations. Mutations are happening. Vaccine have around 80% efficacy. Vaccine reduces the severity of disease. Then simultaneously, the person who are getting the disease, if he is already comorbid, if he is already at high risk, then then the progression of disease is definitely uncertain. So you cannot say that vaccine is not working. Based on the evidence and research, vaccine is working, but there are, depends on the virus, depends on the case, depends on the comorbidities. Dr. Pravez, give your remark of possible DRDO effect on comorbidities. like it's changing metabolic pathways. So you're talking about the drugs, Dr. Pravesh, this 2DG, the drug made by DRDO you're talking about, if I am correct. Doctor, मतलब this Devendra Kumar ji, you are asking कि वैक्सीन लेने के बाद फीवर आया तो कोई और मेडिसिन ना ले तो if you don't take any medicine there will be any problem, but thing is, why to suffer, why to have this? Even if a person gets a acne or some boil and it pains, better to take na. It won't, paracetamol won't cause any problem, any side effect. If at least one, whenever the person is having high grade, give him one paracetamol, it'd be very helpful for him. At least he can do his other work. If the person is constantly having high temperature, he will definitely have a lot of he will lose the mental support and he will start thinking a lot of things. Give him a paracetamol, it won't harm him, it will only benefit him. So how is DRDO's COVID drug? Okay, you want to talk about DRDO's COVID drug? So it's yeah, DRDO is uh, have made a, the drug was there already there, so they have started using for COVID. So that's called 2G. It's a 2-deoxy D-glucose. So what happens is when infected cells being metabolically active, they pick up a lot of glucose. So this 2G, uh, being similar in structures, get picked up by and it blocks the glycolysis and viral glycoprotein synthesis. Basically, what it does is instead of normal sugar, 2G will be picked up, and it won't let the virus 2 be get replicated, and reduces the number of days patient who are on oxygen. So it reduces the days of hospitalization for them, and definitely this all these trials are going on for 2G, and most of the states have started this phase 3 trial is going on. And regarding the 2G, like the anticipated side effect, what they're talking is about QT prolongation. So that is the there, and we have to with 2G, we have to look out for hypoglycemia. Person do not get. Parvez have written, yeah, Ankit Da. So, ये Tamilian uh, or Bengali. Any Saurav Ranjan have retracted the message. So, guys, any more question which I shall take for this, or shall we over the session? It was a very nice experience for me to interact with you all, guys. A few people like who are constantly being with me, like Saurav. People started with this Krishna, Aman Khan, and thank you for being there. Rajat Sharma is constantly Advait. So it was, I think, a kind of a group interaction with you all, and hope I was able to answer most of your question. Rasgulla, we are Dr. Pravez. And I miss Rasgulla now, man. I'm in COVID posting in Haryana, rural Haryana somewhere. So, yeah, so Saurav has asked, so it is drug 2G for the beginning, and generally we say 2DG. So 2-deoxy D glucose. So that is in the trial phase, and most of the thing it will keep on going. Devin Kumar is saying, sir, is it rumor or what that if we continue giving Medrol from day third, it is guaranteed that person will not die? Bro, guarantee तो किसी भी चीज की नहीं होती ना. And Medrol is your steroid. And I'm telling you, like आजकल तुम देख रहे हो that Kali fungus, that mucormycosis cases are increasing. Steroid is one of, could be the reason. Basically, the main reason which they're saying immune suppression due to in diabetes people are having high sugar, and then over that people are taking steroids right and left without consulting. That could be the one of the another reason. And steroid can cause prolonged आपकी जो recovery है, it can delay the recovery. It can prolong the disease if you are taking steroid inappropriately, like you have a mild illness and you start taking steroid early when there is no cytokine, no interaction, less cytokine storm, no cytokine storm, and a lot of things. So if you start taking steroid there, it will delay your illness. And over on the top of that, if you have other, mild illnesses, that will overcome. Steroids are very double-edged sword. There is no guarantee of anything. The person will not die or anything. It's the progression depends on a lot of things which I told. What type of virus, mutant, triple mutant, what strain it is. Depends on the person if he has. Initial phase में तो day 1 to 3 अच्छा sorry, I'm mixing. Though to answer your Devendra Kumar, there is no guarantee for anything. Medrol to be always only given for moderate to severe patient who are on oxygen support. It is best for them mortality उनकी डेथ जो है बहुत सिग्निफिकेंटली रिड्यूस हो जाती है, लेस चांसेस हो जाते हैं. तो do not give steroid for mild cases. People who do not have any breathing problem, their oxygen saturation, everything is normal. Do not give them steroid. Do not start the steroid. If steroid started, take it for. It is given under the doctor's supervision, given for a limited time, and then slowly tapered off. So, Saurabh Ranjan Sharma, I meant this DRDO drug is for patient for initial phases for COVID infection. Generally, what they are giving is for patients who are hospitalized and on oxygen. For them, it reduces the number of days. So generally, so it is on trial phase basis. Let's see. People are saying slowly it will be out open in the market in a small form of pouches, which you have to mix and then keep on with the water and keep on taking it for 2 to 3 times. So, any more question, guys? Steroid should start from which day? Depends when the symptoms start. Can be given after if the symptom if that is what I'm saying. If this your day 4 or day 5 and you have oxygen or breathing problem, or even though if you have breathing problem from the day 1, your oxygen saturation is dipping down, then only start giving steroid. But that also I'll advise you consult a doctor once at least. You can do a teleconsultation. There are national helplines, for COVID. What is wrong in consulting? Just by sitting in a home, if you can get a consultation, there are a lot of NGOs who are doing it. Just note down the helpline number. If you're in India, call it 1075 as a helpline number. If you're in Delhi, you can take a Delhi helpline number. I posted the number here in the comment. Take a teleconsultation. There is eSanjeevani. It won't harm you guys. It's a free consultation these days. If you need any other, there are a lot of NGOs who are giving 24 hours, even at night they're giving free consultation. Take help of them. They will guide you better. And they will give you a legit prescription also. So, guys, if no other question, we can close the session. It was good interaction with you guys. Stay safe. Hope this all ends soon. And let's pray that it ends soon. And it's very important to maintain your positivity. If third wave is there soon, what possible strategy we should make to prevent bad outcomes? If you keep on looking, if you look at the other countries like your UK, generally it takes time before coming the third wave. It's not one after another, but it takes. But nothing is 100% predictable. The possible strategy is definitely the foremost is vaccination. We need to superfast the vaccination trial among children in India less than 18 years of age. The trial will take time, and definitely we need to start vaccinating children too. That will be the most important part. And then later on, appropriate COVID behaviors will simultaneously keep on going. That need to be done. And virus mutations, whatever, we have to keep an, all those national task force are working. There are a lot of committees are working on virus genomics and research. These will guide us better, okay, maybe you need a vaccine dose, booster dose or not. Maybe post COVID you may not need a vaccine at all. So whether vaccine or the your natural immunity is effective against the new strain of virus. So all this research will guide us better. And all and vaccination at large scale will only help. Right now, like if you look at the US, they have said ki if you are, CDC has also guided them, if you are fully vaccinated, you can, and you are in a, even in a closed room, if all people are vaccinated there, you can remove your mask off. So if vaccination goes to that extent, we can, there will be a day where we'll be back, everything will be back to the normal. So let's keep the positive attitude and hope. So bye guys, take care. If you have any doubt, I will given my email ID also. You guys have my Insta ID also, so you can text me your queries or question. Whenever I get the free time, I'll try to answer it, है ना? And I have already my Insta ID is Ankit Samyal. Okay, so everyone to take care, stay safe, get vaccinated. If you are not infected, then get vaccinated. No? And depends on your state also now. Although a lot of fights are going on between state and center who will provide vaccine issues going. But as soon if you find it is there, keep yourself. Uh, I'll suggest right now, whoever is eligible, take the vaccine. More than 18 years of age. If you have no any past history of any major, um, Anupam, to answer your question, if you don't have any this past history of major allergic reaction after your COVID, after your first dose, or any severe allergies or disease like Steven Johnson, and you have other comorbidities also, then if you have other comorbidities, definitely take the vaccine. If you're eligible, take the vaccine. Take any vaccine, whatever you're getting. Do not take the vaccine if you have something like Steven Johnson or a first major anaphylactic reaction after taking the first shot, or a major allergy. Then only if you have minor allergy like allergic rhinitis, minor skin allergies, allergy to minor allergy to food or going out in sunlight, like something like dermatitis, take the vaccine. For minor allergies, can take the vaccines. You have no issues. Taking vaccine will only is one of the major important way to out from this pandemic right now. Chalo, okay guys, good night, have dinner. If you have any issues, let me know. Bye.